welcome to Mother Care. My name is Marian, and it's always a privilege bringing the show to you and hoping that you stay with us from the start of the show to the end of the show. Today we'll be talking about loving my preemie, and that's for anybody out there who's had a baby before term. We do know that sometimes it can be scary, but babies are such a blessing, and I think every minute you have them with you, love them anyway. But first, let's take a mini feature on premature babies, and when we come back, so much more on Mother Care.
An estimated 15 million babies are born too soon, that is premature, every year all over the world. That is more than 1 in 10 babies. Then almost 1 million children die each year due to complication of preterm birth. Whilst many premature babies who survive face a lifetime of disability, including learning disabilities and visual and hearing problems. Over 60% of preterm births occur in Africa and South Asia. Yet, preterm birth is a truly global problem. However, a number of conditions have been identified as possible reasons to a higher risk of a preterm birth. 1. The age of expectant mothers, either at the upper and lower end of the reproductive years, that is, over 35 or less than 18, can be critical. Pregnancy interval makes a difference, as women with a 6-month span or less between pregnancies have a 2-fold increase in preterm birth. Women with a previous preterm birth are at higher risks for a recurrence at a rate of 15 to 50%, depending on a number of previous events and their timing. Under the auspices of Nigeria's Federal Ministry of Health, the Integrated Maternal, Newborn and Child Health Strategy was put together to fast-track a program designed to revitalize primary health care in every local government across the country. Considerably, this will extend the coverage of key maternal and child health interventions, thereby reducing maternal, newborn, and under-5 mortality in line with the 4th and the 5th Millennium Development Goal targets of the country.
Welcome back. It's still Mother Care. Now, it's amazing the amount of people who've had preemies or know someone who's had a premature baby, and also the amazing how people think these kids will grow up. We went to the streets, of course, we always do that, and we talked to real moms who have real life experiences and their opinions on preemies.
A child that has been delivered when it's not up to full term, and care when it comes to such children, they are very, very sensitive, they are fragile. Most times they are kept in an incubator till they are of age before they release them. And when it comes to taking care of such kids, you have to be very, very, very careful, because they are very prone, I believe they are prone to infections, they are prone to diseases around them.
You say pregnancy that is not up to term. And normally, the normal childbirth rate was supposed to be for like that's a weight less than 2.5. If you're above that, it's normal. But when it's less than that, that's when it's called premature birth.
I would like to tell parents, or especially mothers, to stay away from stress. If the mother cannot rest very well, you can see she will fall into forced labor, which make the baby to come out so early. So I want to advise our mothers, our tender mother, that she should be resting very well during the pregnancy, so that the pregnancy can due before they deliver their baby.
What day is it today, darling?
Happy day in Ribena land today. Like harvest full of cheer. Superfruit gonna make your day. Ribena good is yours all year.
The blackcurrant superfruit in Ribena is bursting with vitamin C, making every drop all the more precious. Ribena is worth a little extra for your precious one.
It's a happy day.
Welcome back. It's the Mother Care, and that was real moms talking about real issues that affect you and I. And of course, it's all about preemies. I know you could call them premature babies, but preemies just sound nicer. That's just me being me, but it just sounds nicer. What's the myth about it? What's the big deal when you've had a child and kid has grown and people are still saying, oh, did you know when he was younger he was premature? I hear that all the time and it truly freaks me out. Dr. Gwega Oshika is in the house and we're going to be talking about premature babies. First of all, where's the gap? Where's the age spacing and say, okay, that child is a premature from how many weeks to how many weeks, or how many months to how many months?
Yeah, I think, thank you for welcoming to this program. And I think I'd like to talk about what premature births are. Premature births are births that are after 28 weeks, between 28 weeks and 37 completed weeks.
Okay.
That means because a normal pregnancy, a complete pregnancy, a term pregnancy is 37 completed weeks.
Okay.
At least 37 completed weeks or 38 weeks. However, if a birth is before 28 weeks, it is regarded as an abortion in this environment.
Wow.
In the United States of America, or WHO standards, less than 24 weeks. And that is because of our neonatal salvage rate here. And in this environment, fetuses that are less than 28 weeks are not likely to survive. So here, we choose 28 weeks, and many developing world, 28 weeks is a viable pregnancy, viable gestation. That's when you can say, this is a baby. And between that and 28 weeks and when it is time, if the baby was born, it is a premature baby.
Okay.
Yes.
Now, there's some kind of stigma, especially in our society, when she had it. They whisper it. It's a whisper. When a woman has a baby, you say, she just had a baby. Then, oh no, she had premature. They actually whisper it, So that is really, really weird. But I know there are a lot of complications that come with it. Before we get into the hang-ups and all the myths surrounding it, what are the issues that can come around having a premature baby?
Well, some of the causes of having premature deliveries, one of the commonest causes is having multiple gestation, because one of the triggers of labor is how distended the womb is. If the womb senses that it's distended enough, then it goes into spasms and contractions. However, if there are 2 or 3 babies there, to achieve that amount of distension would be easy. That is not likely
to get to the full term.
To get to the full term.
Achieved it already.
Once you have twin gestations or multiple gestation, multiple births. Other causes are women will have a very loose cervix. Once the cervix has been tampered with initially from previous abortions that was not cleverly done by an obstetrician and gynecologist, maybe it has been dilated. Or some women just have very loose cervix or very short cervix and didn't get the opportunity to have a cervical sacrilege where the womb is tied at the cervix,
Oh, okay.
so that the baby can stay there. By the time the baby in the second trimester gains some weight, that weight impinges on the cervix and that cervix begins to dilate. And at that point, the baby starts coming out. So that's one of the commonest cause again. One of the common cause of preterm deliveries in this environment. Other causes are women will go into premature labor or preterm contractions, commonly in this environment because of malaria infestation and urinary tract infection. That can predispose a woman to start contracting and go into preterm deliveries.
Okay, now when you do have the baby and your baby is already out, what are some of the issues for a preterm baby?
For a preterm baby, because it is a continuum from when there's fertilization, growth is a continuum to when the baby actually comes out. It just happens that the baby has to be inside the mother's womb from when the sperm and the egg has been fused to form a zygote to 37 weeks. However, if the pregnancy is terminated around between 28 weeks or 30 something weeks, the developmental process that had not been completed the baby will have to, the obstetrician or the pediatrician saying the baby will have to contend with that. For example, the babies born before 34 completed weeks or 34 weeks gestation will have issues with respiration because fetal lung maturity starts at 34 weeks. So if the baby is born before 34 weeks, of course, in this environment now, I hear there are some surfactant sprays that you might just need to spray on the baby by the neonatologist, and the baby will be able to gain spontaneous respiration. If not, the baby might have difficulty in breathing well and may have respiratory distress syndrome, and the baby might die as a result of that. Because also their liver is not yet matured, they have problems with conjugating bilirubin, which is a component of blood which may be broken down in the baby, because babies need a lot of blood to stay in there because the inside the womb is in a hypoxic state. There's little oxygen there, so they need a lot of blood to trap the little oxygen they might have.
Okay.
So when they come out where oxygen is abundant, they need to destroy a lot of blood. So one of the components of blood is bilirubin. Once the blood is destroyed, the bilirubin is now in the blood. It needs to be conjugated by the liver to make it less harmful. But because they have an immature liver,
Might not be able to do
may not be able to do that, so the baby becomes jaundice. And bilirubin is very, very toxic to the brain. And the baby suffers what is called kernicterus.
Okay.
And the baby becomes very abnormal, and brain growth is retarded. So there are other issues. Feeding and sucking reflexes might not be there, so the baby needs to be fed. Babies who are also premature have very low glucose. They are susceptible to infection because their skin is immature, their immune system is immature. However, in this environment, many people do not use the service of neonatologists. I think we should encourage more people to deliver in places where they can have access to neonatologists. However, if they don't have in that place, they should seek one immediately if it is a premature.
Now, I can't let you go without asking one final question. You know, as you grow older, you have some friends in class that behave a bit, they're slower than most kids, they're clumsier, and then you hear phrases like, he was born premature. And you're thinking this child is like 15 already, but he's still connected to the fact that are there any effects after as the child grows like every normal child?
Absolutely not. A child who was born premature will behave normally as long as all those issues have been corrected, have been dealt with. He has no problems growing like a normal child.
So that's one myth that has just been totally dispersed, because I hear that a lot. Yeah, some not very clever kids, and they go, it was born premature. Thank you so much, Doc. Thank you so much for educating us today on premature babies. And if you're out there and your kids came early, you know what? Just see it as an early gift from God. If all the issues have been solved, enjoy every minute of your baby, because there's absolutely nothing wrong with the Premi. Take a short break and we'll be back.
Health walk. Know the benefit. Physical activity doesn't need to be complicated. Something as simple as brisk walk as often you can get to do it can help you live a healthier life. For example, regular brisk walking can help you maintain a healthy weight, prevent or maintain various conditions including heart disease, high blood pressure, and type 2 diabetes. Significantly reduce internal pressure in the eye that can cause glaucoma, strengthen your bones, lift your mood, improve your balance and coordination. The faster, farther, and more frequently you walk, the greater the benefits.
We hardly have time to go out to relax, so we accumulate a lot of stress. And you know that most dangerous diseases are caused by accumulation of stress in the body. So we intend to make it more regular.
It's good. I decided to support it because we believe that when people are alive, you too, you are alive, your business will be alive. So if you don't have people around you, you can't do business. So you have to make sure they are alive. And to do this exercise, to do this work, is to make them alive. So we need to support so that they will be around to do business with us.
No better reason, therefore, that glaucoma was chosen as a theme for the regular health walk organized by NTA for its staff and interested members of the public. This particular edition of Walk was given promotional support by Pfizer, one of the giant multinational pharmaceutical companies in the country. The 5-kilometer walk was brisk as well as fun-filled with music and dancing all along the routes. What is glaucoma? Glaucoma is a group of eye disease that can damage the eye optic nerves and result in vision loss and blindness. However, with early treatment, you can often protect your eyes against serious vision loss.
Well, glaucoma actually has to do with, it's an eye disease, okay? And it represents like the increase in pressure of the eye, both eyes. In the past, one had always thought it was due to just increase in pressure, but now I've known that it is not only when there's an increased pressure that you attempt to use the word glaucoma. There are other associated health problems that come with it. So it's a combined thing.
This is underlined by a study that showed that glaucoma patients who walk briskly 4 times per week for 40 minutes were able to lower their IOP enough to eliminate the need for some form of medications.
Welcome to your segment on Mother Care, Doctor on Demand. As usual, I'm your regular host, Dr. Martina Agbeme. Last week we got a lot of messages, text messages, emails, and of course on our Facebook on different questions. So we decided to scroll those questions to let you know the ones that will be taken this week. So this week and subsequent weeks we'll be answering the questions as they come. So today we're going to start with the questions. Number one, he said, my baby is 1 year, but he cannot stroll and walk along. What would I do? You can see that from this kind of question, the parent is actually anxious and obviously worried. At 12 months, that is 1 year, and the child can't walk nor stroll, is not something that you should be perturbed about. It's not what you should be worried about. Because we have what we call the developmental milestones. When we talk about the developmental milestones, we're actually, is a kind of set, is a kind of, let me put it this way, something that is a standard that you work with, okay? It's what is expected, it's a guide, okay, good. It's what we term as a guide for the doctors, the practitioners, and even the parents to know how the child is developing. It is expected that from birth up to 1 month, 2 months, 3 months, until you get to different ages, what is expected of the child. So at age 1 year, which is 12 months, we know the things that the child is expected to exhibit. So this is only one, which is the motor skill, not walking. You shouldn't be worried, because are there other things that the child is exhibiting? Is that child able to sit without support? Is that child able to look and move around? Is that child able to grasp your hand? Can the child take a cup to take what, if you want to give the child water, can the child hold water or the cup and want to drink? Do you support that child? If the child needs to stand up, do you need to support that child? If the child is able to do all those other things which are part of the motor skills, it means that child is on the right path. Then if the child at the age, when it's like 18 months and the child is unable to walk, then that is when you need to see the pediatrician, see a doctor for counseling. But at 12 months, that child is still very okay. You don't need to worry, because children have different times of development. Some will probably walk earlier at 7 months. Some won't even walk until like 18 months. So do not look at the other child's development and begin to get worried about your own child. Just every child is unique in his or her own way. So you take a child at a time. The first child might not walk at the same time like the second child, okay? So that is for developmental milestones. So that is what you should look out for. The child is unique, children are unique, different times, they do their different things on their own way. Then the second question, what should you advise mothers that are supposed to breastfeed for like 3 to 6 months and having sex to save their marriage? Are they supposed to have sex while breastfeeding? This is the question you want viewers to know. Really, yes, you want viewers to know this. Are they supposed to? There is absolutely nothing wrong in having performing your marital duties at the same time breastfeeding. Breastfeeding actually exclusively has been proven. It's a form of contraception for mothers. So a mother who breastfeeds exclusively and follows it religiously will not be able to get pregnant until she stops that breastfeeding exclusively at 6 months. So if you don't add any food, no water, no added meals, exclusively for 6 months, it's been proven that exclusive breastfeeding is a form of contraceptive method. But of course, it does not interfere with your marital duties. So you can breastfeed your child, you can also perform your marital duties. Well, as usual, we've come to the end of today's own segment on Doctor on Demand. Just don't forget to send your text messages. And of course, visit us, go on Facebook and also send your messages so we can keep taking them as we get them. Thank you and God bless you.
I do hope you've enjoyed today's topic, loving my premies. And then for those of you who have premature kids and you have an issue with diapers, did you know there are diapers specially for preemies? Trust me, they're there. You just have to look for it. But you can actually have diapers that are not for newborns. They're actually for premature babies. It's snugger and it fits much better. Thank you so much for being a part of the show. We'll be back next week with another interesting topic on mother care. Remember, we'd love to hear from you, so use any of our social medias and send us your questions, your comments, and just share with us all the experiences you've had as a mom. And dads, you're not left out, okay? You can share your experiences with us also. But I always say, being a mom, it's the best job ever. Thanks for watching.